I have two patients on the geriatric service. The first one is in room 4242, Mr. Appleton, patient of Dr. Abel and Dr. Coder.
So he's had 2 strokes in the past and has some cognitive impairment. The reason he was admitted yesterday from Silver Lake Nursing Home was essentially failure to thrive. He stopped eating for 3 days.
But he did just have 80% of his breakfast today. The plan is to get him up and start with a cardiac chair until PT sees him.
We're understaffed this week, so I probably won't be able to see him today.
That should be fine.
Yeah.
Okay. On the other hand, the care partner said he was saying this morning, "I want to die, I want to die." He did not say this to me, but he definitely has signs of depression.
Yeah, apparently his wife is in another SNF, and she stopped visiting him, so he's convinced that she's dead. So Dr. Mitchell called me this morning and gave me the information where the wife is, so we need to figure out how to get them together.
In the same
In the
SNF.
same place.
Okay, where is his wife?
West Harbor Convalescent Center.
Oh, that's far.
Yeah, and the phone number I got from Dr. Mitchell is 310-555-1112.
555-1112.
Yeah, I think she was admitted for an SBO, but I'm not 100% sure. So he has this history of depression in the past, apparently, based on what Dr. Mitchell told me. He just seems to be... And I'll have Psych see him, see if Jerry Psych has any suggestions for his medication, but in general, he seems to be improving, because based on what they told me, he wasn't eating at all, and now he's eating a little bit. He seems to not have too much pain, but I can't really...
He does have pain.
I don't know, were you able to figure out what he was saying about his thigh?
He didn't say thigh to me, but I asked him to pinpoint for me, and he pinpointed somewhere, I guess, where his bladder should be. So I'm going to do a bladder scan to see if maybe he's got some residual.
I just saw him, and he said his pain's from here to here. It's kind of ill-defined.
Okay.
He also has aphasia from the stroke, so it's very hard for him to express. We're going to need to rely on nonverbal cues.
Yeah, a lot of it's hard because he can't really speak to us.
Well, maybe I can call West Harbor Convalescent and get his wife on the phone. And if he hears her voice, he might feel a little more relieved.
Oh, that would be really, really, really nice. I think that's going to help a lot.
Yeah. So I'll call there and I'll go to his room now.
And I'll talk to Dr. McNeil and see if maybe she can see him tomorrow and see if she has any suggestions for psych meds. But a lot of this, I mean, he's had a massive stroke, so it's not surprising that he's got all these depressive symptoms. But he's very perceptive, and that's the thing that everyone needs to know. He understands everything that we're saying.
Yeah.
Okay, so ultimately you want to stabilize him and send him to where his wife is?
So we need to find out if they're able to take him, but he'd go as a self-pay?
He has to. He has no more Medicare days left, so he's used them all up.
So we're gonna need to find out who's gonna pay for him now.
Apparently he has resources.
When you say resources, do you mean Social Security?
No, he was financially well off. I kind of researched him, and it seems he was an author and he worked for software, so that's why we thought he probably has some resources.
But because of his aphasia, we can't confirm.
Okay, so we need to find out from the family. University Hospital does have some beds at a lower level of care that they might want to look at if, Medicare stops paying for this admission. So the wife's the DPOA and in charge?
We don't know. I don't have any more information. I mean, Dr. Mitchell thinks that she was the one who was managing a lot of this since he had his stroke, but she got sick herself recently, so. And there's a son too. I tried calling. I did not get an answer.
I can call him too.
Okay, the numbers are on the chart. If you go to the chart, there's a cover sheet and all the numbers are listed underneath.
Okay, good.
So from a medical standpoint, we're thinking in a day or two, maybe we'll stabilize him?
We need to make sure there's nothing that we're missing, so we can't be 100% sure.
So not today then?
Not today, but maybe tomorrow. I think tomorrow we could easily get him out, and I don't think there's anything too serious going on.
Do you think he'd want to speak to a chaplain too, or no?
You can ask. He'll say yes and no's. He can do that. He'll try to talk to you, but nothing comes out.